Welcome to Fertility Friday. My name is Andrea Trigo. I am a fertility nurse consultant, and today I'm going to talk to you about identifying your fertile window. The fertile window is that time of the month when pregnancy is possible. Identifying your fertile window and having intercourse during this time increases your chances of pregnancy. Today, we're going to tell you how to identify your fertile window. Even though we are taught that pregnancy happens easily, quickly, anytime, that is just not true. There are actually only 6 days a month when pregnancy is possible. These 6 days of the month include the day of ovulation and the 5 days before. This is because the egg can survive up to 24 hours after ovulation, and the sperm can survive up to 5 days in the female reproductive system. So, how do you identify your fertile window? Well, there are several methods of identifying those fertile days. However, some methods are a bit more reliable than others. These methods are analyzing changes in your hormones that happen throughout the cycle. They can also identify physical signs of those hormonal changes. So let's look at a few methods to identify your fertile window. Cervical mucus. Cervical mucus will change throughout the cycle. And during your fertile window, you will notice a cervical mucus that is very wet, stretchy, and similar to raw egg whites. This is because it allows the sperm to swim a bit more easily to meet the egg. If you make note of what your cervical mucus looks like every day of the cycle, you will notice these changes during your fertile window. Basal body temperature. We know that basal body temperature changes throughout the cycle, and this method implies measuring your temperature every morning before any activity. We know that just before ovulation, temperature reaches its lowest point, called nadir, and after ovulation, as the corpus luteum starts producing progesterone, temperature starts increasing. Because basal body temperature only identifies fertile window after this has passed, this is not a very good indicator of when to time intercourse. However, it is a good indicator that the fertile window has passed and conception is no longer possible during this cycle. The last method I want to tell you about is LH surge monitoring. LH is a hormone that is produced by the pituitary gland in the brain. And when this hormone reaches a certain threshold level, we know that the egg finally matures and is released from the follicles in the ovaries, the process called ovulation. We know that this hormone starts increasing around 35 to 44 hours before ovulation, giving you a few days to time intercourse and get pregnant. If you use Milo, you will know your exact LH values at baseline and surge. This is particularly important if you have PCOS, irregular cycles, or any hormonal problems. Every woman is different, so it's important to find out what is normal to you so you know when is your fertile window.